I feel very privileged, actually, to have been here today and had the chance to be here at the beginning and here at the end and all the way through and heard almost everything that was said. And I go to a lot of these meetings. I do this a couple times a week, probably, in one forum or setting or another. And sometimes it's with technology companies and industry. Sometimes it's with activists of various kinds or government agencies or medical societies, all about personal health records and how they see it through the lens through which they look. And this is a very sophisticated conversation you've had. And because I see a lot of them, I can tell you that. You are operating, and just in a couple of years, have come up to a level of subtlety and depth in what you're talking about that's very important and very empowering and enabling. And I think you're at a place now where whether you think of yourselves as a group or not, and I'm not sure about that yet, but de facto as a group who came to a meeting, you have the potential to really influence what happens in the country. And having said that, and realizing that you are ready for action from a lot of what I've heard, and you have a lot of understanding of the complexity of what you're getting into, and you don't seem to want to wait for the world to come to you, but you're ready to go to the world. I just had a couple of observations that are just contextual from what I've heard today. I think we heard today there are many opportunities to create value. We've heard very creatively about opportunities for personal health management, and June suggested some things very specifically about she could imagine ways of PHRs adding value to individuals in their own lives and experiences. And we heard about process improvements, how the healthcare system could have the benefit if we had consolidated our health information and made it available. But Steve started us off talking this morning about the eligibility determination, the kind of boring administrative procedural issues. And I do want you to come back to what Ed Foch talked about, which was the, I think, hard-earned experience of what does it take to make this really happen in the real world. And one of the things I've observed in watching this field for a few years is it's really hard to get momentum, either with physicians and other professionals adopting these new technologies to move information around, or with consumers and people in the public to do it. And I think, like Ed, one of the things people observe in this is there's really no reason to move information around for most of us most of the time. Those big delivery systems I talked about this morning, who certainly have the capability and the money and the resources to make information available to people and to ship it around the country, don't really want to. There's no business reason, alas, for that to happen. So there are two broad paths that'll make this move. One is laws and requirements, and the other is business motivation on the part of people who have to make changes. So I think it's really important to think about that, and for that reason I come back to the suggestion Steve made this morning that one of the use cases, if you like, that really deserves your thinking is, where's the money? Or as Debbie said, and Marty said this morning, if there's $500 million sitting somewhere being spent on medical records extraction, if there's a way to redirect that to stimulate this field, that's something very important to think about. So essentially I'm saying follow the money. Not to dismiss the other high-value services, but we're not going to get to those until we stimulate this field, and that's going to require leveraging some resources. The second general observation I wanted to make is for you all to think carefully about where you want to act and where you can have an effect. And the big differentiation I want to leave you with is between what we call applications versus the network or the infrastructure. And both are deserving of your attention. The applications are what you and I experience as users. And we heard many good suggestions today about ways to improve those. The infrastructure is, I think, what you alluded to about the universality issue, universal design, I think you called it. There are going to be much larger forces than any of those that even SSA touches moving the infrastructure around for the next 5 or 10 or 15 years. And that's basically a set of tidal waves you need to ride, and maybe you can redirect or at least have your boat successfully ride across them to the destination. But it's very important to get the infrastructure right. And as a community, to the extent you can be influential in getting that right, in advising Congress or the administration or large private sector players and consortia or the health plan industry, if you can pressure them to get the infrastructure right, there will be thousands of creative people developing solutions that people can use to improve their lives. If the infrastructure isn't right and the data can't move, as it can't today, it won't matter how brilliant the guy in his garage is with his computer, he still can't get the data out of that laboratory, out of that hospital, out of that claim system. So getting the infrastructure right is a real opportunity for you that you can, I think, be very influential, as Mike Zamor suggested. And the third thing is partnerships. And really, as several people have said, there's no boundary to the disability community. You have partners and allies in all kinds of places. I'll just let you know that there are other consumer groups in particular, and I think Mary Jo and others mentioned the cancer community as an example, but there are several coalitions of consumer groups working on the same subject you all might be working on. And I'm sure there's a lot of common ground or a lot of mutual learning that could take place if it's not yet common ground. So I think allying and partnering with other consumer organizations and frankly even the commercial companies who may be developing products would be opportunities for partnerships with you as well. And it's one of the things I can offer to do in my contribution here is to help link you up, whether it's with commercial entities or consumer organizations or patient advocates who might share some common interest with you in trying to shape the design of this infrastructure going forward. So that's all I wanted to add for the day. I think you've done a phenomenal job today. I really appreciate what Tom and Steve and everyone has done to move this along. You have the opportunity to provide real leadership to this central part of our future in healthcare in America. So I thank you for letting me be part of it.